So on the agenda for today, we will focus on the GoEast project by ERN Lung. It is a patient-led initiative that aims to raise awareness about ERN Lung among healthcare professionals in Eastern European countries with the objective of having professionals from these countries actively involved in the network. After presenting the project, we will jump into analyzing it from a patient-clinician collaboration perspective. And we will also present some highlights and lessons learned so far towards the end of the webinar. And there will be some time for Q&A also at the end of the session. We hope to have a very interactive webinar, so please feel free to jump into the chat in order to make your contributions. And at any time, we will try to read them. It is now my pleasure to introduce our speakers. We have with us today Francesco Bonella, Respiratory Physician and Coordinator of the Core Network Sarcoidosis.
Thank you for the invitation.
Thank you to you for being here. And we also have Gergely Meszaros, ERN Lung Project Manager and EPAC Patient Advocate. Hello.
Hi, thanks for having me.
So Gergely, Francesco, the floor is all yours.
Many thanks. And also warm welcome to this webinar. Thanks to Eurordis for organizing this meeting for us. And it's also a great opportunity for us to raise awareness of this project. So many thanks again. Let me kick off this meeting with a quote which I really like, and I think it's always resonates when it comes to rare diseases. It is about a quote where we say that in isolation, we are not strong enough. We always say that we are rare disease patients. However, when it comes to the sum of the rare disease patients, we are not alone. This is definitely true. This is definitely true for countries. But if you check this very nice map, you can realize that somehow there's a big gap between Eastern and Western European countries. The dots and these kind of signs are representing ERN lung coverage in terms of healthcare professionals, in terms of patient organizations. Can you please go to the next slide? And once it comes to hard data, you can see on this very nice spreadsheet, which was actually made last year, so it is not updated as a result of our activities. But you can see that some countries, we can say that they are completely white spot countries, which means that we do not even have any connections to healthcare professionals, so they are not part of ERN Lung, even as a full member or even as an associated partner. Some countries are represented well, which means that they are part of some of the core networks. Within ERN Lung, we call core networks as the disease areas. So the first one is alpha-1, cystic fibrosis. You can have in the abbreviation, CLUD, institutional lung diseases, pulmonary hypertension, PCD, sarcoidosis, and so on. So you can see that some countries are quite well covered, some others are not. So our objective was how we can make better represented ERN lung in these countries. So the Go East project is about focusing on Eastern European countries, but we also realized that there's a gap in terms of Greece and Cyprus. So we are going a little bit south, so not only Eastern European countries. Next slide, please. So based on the previous approach, we figured out that we need a systematic target to these countries. We know that, as I mentioned, in some countries, we do not even have any connections. For these countries, we need to establish connections, for instance, for Bulgaria, Romania. Naturally, we need a completely different approach in those countries where we already have centers. But probably these centers are not the biggest one, not representing the main population. And on the other hand, and probably this is the most easiest way, and this is the so-called low-hanging fruits, where we have centers on board, but we would like to have these centers being represented in other disease areas. Next slide, please. So once it came to the build-up of this project, we thought that, sorry, I just read the comment from Hansi. about where Austria should be put on the map. I'd rather say that Austria is rather a Western European countries, but we know that in Austria there was a bit of problematic legislation in terms of how they implemented the cross-border healthcare directive. So this might be the case that for Austria we do not have many full members, but rather associated members. So back to the main topic, as you could see, we tried to build up a multi-stakeholder project team where we have the network coordination team. We also have patient and patient organization. I will talk later a bit more on the key role of patient organization, especially in white spot countries. And naturally, we have very strong allies, and we have the privilege to have here Francesco Bonella, who is a very strong ally in terms of how we can extend our coverage to other countries and to also extend our coverage once there's a healthcare professional already part of our network. Next slide, please. So once it comes to the tools, how we try to address these countries, we thought that it needs a differentiated approach, as it was already communicated. So we try to have some workshops in those countries where we do not have connections, like in Romania and Bulgaria. Sometimes it's much more easier to organize online webinars, but for this you need some contact details from these countries to these physicians. So we already make quite a lot of this for pulmonary hypertension and for IRD, and Francesco will also talk about another one. And wise, it is about having nice networks to these countries. Referrals are also important. So I have many one-on-one meetings with physicians from these countries, where I try to sell ERN lung as a great opportunity to connect. So sometimes these kind of tools resonate what the situation of the country. So I think it's practical saying that it's no need to organize as a first step workshops in those countries where we already have connections. It might be easier to make one-on-one meetings and webinars. But we realize that in some countries where we do not even have any healthcare professionals, it is worth having a workshop, because I will cover it later. You need a really multi-stakeholder approach on this. Next slide, please. And this is a sample workshop we are planning, and it was really great to see that we have Natalia from Bulgaria, who is a great supporter of this project, because they thought that once it comes to Bulgaria, we need to explore what possibilities we have. The problem might be, for instance, within the legislation, or it might be cultural, or it might be on the end of the healthcare professionals that they think ERNs are not a project they are interested in. So we thought that we are trying to use as many possible tools as we have. So we sent a letter to the R-Pharm, which is an association of the local pharmaceutical companies, to ask them whether they are supportive of such kind of workshop, where we try to raise awareness of ERNs and more specifically ERN lung. We also realized that one of the university hospital in Bulgaria, which is based in Sofia, is part of the Jarden project. I presume many of you are familiar at least with the concept of the Jarden project, which is about how we can integrate better ERNs and ERN centers in the national healthcare system. So it's also a great opportunity to connect the Medical University Sofia on this. As I mentioned, we have very strong allies in terms of patient organization. We already have nice connections with local Bulgarian patient organization with interstitial lung diseases, pulmonary hypertension, and cystic fibrosis. So I think that it also gives us a great opportunity to organize this workshop. On top of that, once it comes to funding, you always ask how it is possible, because it is not about a Zoom meeting where you only invite people. We have also looked at more closely to the possible funding, the funding possibilities. And for the EU Health Program, we might have some opportunities because there's a very nice call in terms of conferences. It says that it cannot be a disease-specific one, and it should also address EU-wide or EU-level policies. I think that ERN Lung workshop might very nicely suit this, but we also recognize that it will be very popular for other disease areas. So you could see that we try to use different tools and approaches in terms of how the country is situated, whether we have any connections to their already existing relationship. And in the next slide, Francesco will walk you through in a webinar what we organized already for sarcoidosis.
Exactly. The sarcoidosis core network has been grounded last year in March after interaction with all the sarcoidosis patients association. So it's the newest sarcoidosis network within ERN Lung. And we had started some project. One of the project was the survey on existing registries and biobanks. So now we have the results of the survey, and as we expected, we don't have the voice of the Eastern countries. And that is exactly the problem. So all such projects within the ERN without the voice and without the feedback of the Eastern countries are unusable because they describe only the situation in the Western countries, which we already know from publications or from interactions within the neighbor countries, or cross-border possibilities which are already in place, like Germany and the Netherlands, or Italy, Austria, and so on. And this was a little bit disappointing because, of course, these results will draft a map of the existing registries and biobanks for the sarcoidosis, which is not complete. And won't facilitate the research projects involving the Eastern countries. We have organized a webinar on invitation basis, inviting Poland, Slovakia, Hungary, and Romania. It was a very nice meeting, brainstorming how to join the ERN Lung as full members or affiliates members, and then which are the requirements. And of course, it was crucial for these countries to know that the numbers, so the minimum requirements for joining the ERN Lung are flexible. So we provide such a number of patients or number of procedures to diagnose a disease or a treatment possibilities, but we can adapt all these numbers, let's say, and possibilities to the epidemiology of a disease in a country, or of course to country size, because it's unthinkable that small centers or small countries provide, I don't know, 500 or 700 new diagnoses per year of a disease where the epidemiology doesn't allow that. So these kind of webinars are extremely important to understand situation. And of course, besides patients' care and the numbers and the requirements of the center, the final goal of this networking is also if the members want to be full members, but only affiliates and so on, or just expressed interest to join or to be part or to receive information about the activities of the network, is to provide high quality, high structure research for certain diseases. And with the final goal to provide care to all the patients, to homogenize the patient's journey across the countries, because we cannot pretend that each center have the same facilities, of course. This is not thinkable. Even in the richest countries, or not every center can perform genetic analysis, for example. But if I am connected to other centers doing that, and there are agreements in place for a cost refund, or even without any cost to perform such final diagnosis steps. Yeah, it's an advantage and a win-win situation because we can publish this data. You can have diagnosis, so with low cost or no costs, and at the end of the day, this will be not just a dream, but a very well performing network for patients, ultimate patients care, and of course, as you can see in the slide on the right side, for a high level research. In the next. Exactly.
It's coming back to me.
Yes, back to you.
I think.
Exactly.
Many thanks, Francesco. And I'm really happy that you mentioned this kind of membership because we did not cover this within this webinar, but I presume some basic information should be shared. So as you might know, there's no open call currently from the European Commission, so it's not possible to join ERNs as full members. Originally, there was a possibility to join as a full member, so there was a very complicated kind of procedure. Some of the countries were missed, as we have some notice from Hansi, for instance, Austria. So there was another round of applications where they said that, okay, there's no problem if the local implementation law was not made in time. So we would not like to exclude these countries. So it's possible to join as an associated member. After that, there was no possibility to join ERNs. However, we firmly believe that the ERNs are more stronger if we have a better coverage. As Francesco mentioned, we do not only would like to have the view of the Western European countries. So we were talking about whether it's possible to open a door a little bit to these countries and these healthcare professionals. So within ERN, we have a so-called supporting member or supporting partner. The supporting member means that these members are not going through the original application procedure, but we require from them to fill out the self-assessment form so we have a good understanding of the healthcare providers, as Francesco mentioned, in terms of international collaboration, in terms of minimum criteria, which is outlined in the European Commission requirement. However, we are very flexible in terms of the numbers due to the size of the population, due to the special approach of the country. However, if these applicants are fulfilling all the criteria, they are called as supporting members because they might be considered as members if the call is open. However, other healthcare professionals might not fulfill all the numbers, so we call them as supporting partners. And the brackets are closing here because I think it might be also interesting to learn how this project really contribute to the overall fulfillment of ERN's goal. The Commission has the standpoint that it should not be open, the ERN should not be open to other countries currently and to other healthcare professionals in order to avoid the dilution of the expertise. And we also agree upon this. So within the first 5 years, we were on the standpoint that we try to have the network working in an appropriate way. However, if you approach a little bit from another angle, ERNs, for instance, from patient rights, it's obviously a yes to this question whether you should go east. Why? Because we also would like to distribute some of the knowledge we have. We also would like to ensure cross-border healthcare models. Naturally, new pharmaceutical advances should be available in Eastern European countries. And naturally, the most important goal, one of these, is to have more efficient use of costly resources and sustainability. But we have another nice visual. I think Francesco will walk you through on this very nicely. Next slide, please.
Yes, thank you. And just to add comment what you say, the goal of the ERN is not to have 20 centers in Germany dealing with a disease or having the expertise with this, but having a large number of countries with 1 or 2 centers connected each other and with the other countries, ensuring the right patient's journey in terms of diagnosis and access to care. So this is the goal of the ERN, because what I remember from the first call in 2016, 2017, there were a lot of requests. I remember from Italy, from Germany, 30, 40 ACPs willing to join this network. But we should apply these numbers at that time to select these centers, because I repeat, the goal is not to have a plethora of centers in one country, but to have a few centers with real expertise, but in a larger number of countries. And this is the vision and the audience of the ERN project. You see the black core encompassing clinicians, experts, working group, the DG Santé in the European Commission, and of course the patient's representative. And then we have the primary audience of this ERN network, which are patients, the patients' representatives and association, but also the families, GPs, for example, other medical organization, or hospital and clinics. We have a secondary audience represented by, of course, the authorities and the institution to take decisions together or to change some health policies which are no more, let's say, current for a disease or a group of disease, academics, and also specialist clinicians, which are in secondary or even tertiary centers. And then, of course, the largest audience, the so-called tertiary audience, which is the general public. And once we reach the general public, of course, that means more funding for cross-border care and also more funding for research. But this process should really be more inclusive in terms of geographical coverage. That's why we have underlined that in the text of the slide, and remains one of the major goals we have to achieve altogether.
Yes, if you ask more specific contribution to ERN's goals, we made a specific slide for this. So we firmly believe that Eastern European member states should have access to best possible treatment in terms of patients. So how ERNs can help? With highly specialized centers. So these local healthcare professionals can connect to the respiratory knowledge hub, as we call ourselves as ERN Lung. They can be part of international collaboration and also participate in clinical trial networks. I think it's also a kind of interesting opportunity for these healthcare professionals. On top of that, there's a kind of criticism about CPMS. It's quite complicated system and so. However, it also ensures these healthcare professionals to connect to highly specialized centers in the Western European countries through CPMS. And I think it's a special platform what we have in ERN Lung. It is called the EXABO. This is the Expert Patient Advisory Board, where patients can directly raise questions which are answered by physicians in their local respective language.
May I add something about EXABO?
Sure.
Thank you. Yes, there is a huge difference between CPMS, which is for physicians, and you can share every kind of findings, let's say image, laboratory, patient's history, and everything. And EXABO is more for patients and the general question about the treatment of sarcoidosis. You can start, of course, also from your experience or experience of friends, or you have heard, just to ask where is the next center to my place, or the closest center to my place dealing with this disease, or which is the name of the expert in this field, or asking for. So we cannot provide via EXABO any kind of therapeutic advice, because the majority of countries is not allowed. Like in Germany, I cannot write, okay, please take now 20 milligram prednisone or something like that for your disease. But we can for sure help a lot in finding the right people. who can help you close to your place. So just to clarify a little bit about the second opinions.
Thanks, Francesco. It's gives the full picture. You are right. And on top of that, there's also possibility once someone is part of ERN to get in contact with the patient community. I know that many platforms are available, but I'm a big fan of ERNs in terms of that it's a unique possibility to also join to some projects which are not available within your respective scientific society or within talking about only patient community. Next slide, please. And I think that this is probably the heart of today's presentation, where we try to explore a little bit more how this project actually working in practice. We have many principles, luckily, which Eurodis nicely pulled together, but we would like to show you that actually these principles are working in practice. For instance, what do you think about Francesco continuously working together principle?
Yes, is essential for the success of the project, of course, and we are trying now to involve patients and health professionals at the same time in guideline processes, and of course, when specific situations occur, for example, in the treatment of a group of disease which is neglected, and to provide a pathway to reach the specialists for diagnosis or the access to care. And I have to say, we are more focused than some scientific societies, because the focus of ERN was from the beginning the patient's care, and through an adequate cross-border patient's care, then also doing research and international cooperation. But here we focus really on listening the voice of patients and then adapt our pathways on what on the feedbacks we get from the patients association in one disease, or for example in the functional committees when it goes to communication or delivery of results of clinical trials, for example. So you see here a list of sentences and terms which are of course general, but we can provide for each one of these wording or sentences a concrete example which can convince you to join this network, and then join this network is an advantage. Of course, it's also work. Yes, add-on work on your clinical activity, and for the patients also. In the networking costs a lot of energies, and then to be present at these meetings. Now we have, of course, new tools and everything we want. So from the participation, physical participation community is no more the problem, but the quality of the discussions are, of course, different. So it is important that the dialogue is continuous. There is mutual recognition, learning from each other, and then involve the patients in this guidelines process, which of course are the main focus of health policy makers. So they read the guidelines and they decide to change some policies about cost refunds or treatment access and so on, based on these guidelines. If the patients are present in these guidelines and they also appear in the flow charts of the diagnostic or therapeutic algorithm, of course, there is another impact, and higher impact on policymakers. So we have the communications and involvement of patients starts from the one-to-one relation, physicians and patients, and then of course patients representatives together in federations or bigger groups, and then invitation to participate and to write together the guidelines, or to translate for patients the results, the latest results, or the most important results from clinical and basic research sometimes in order to provide a common platform for future better care and also better research, more patients focused.
Yeah. Thank you, Francesco. Let me pick some of these principles and providing you some examples from our project. Probably the first one is self-explanatory in terms of that it's a continuous work. So do not think that we just run one webinar for instance, sarcoidosis, and we left these healthcare professionals to think about. So after that, we are sending follow-up emails asking what's your thoughts about this. We have for instance, meet with others in person and asking what's happening. They said that, okay, it's quite complicated in my hospital because I need to go back to the director of the hospital, because once you are becoming a member, even though it's a supporting member, we really ask from these supporting partners or members to try to fill out those reportings, because it helps them mature and it's a nice self-reflection for them. Once there's an open call from the Commission, they become a full member. And this requires some resources on their end. So we might also have the situation where the physician is really happy to join our network with that respective disease area, but he or she is lacking the resources which make it possible. You need to really understand the big differences between Western European countries and Eastern European countries. For instance, in Belgium, University Leuven is part of more than 20 ERNs. So it's not a big issue for them to join another ERN because almost the same reporting is happening. But for instance, in a smaller country or a not well-advanced country in terms of reporting obligations, I was questioned a couple of times what kind of reportings we are really requiring, and they were checking whether they are already have these numbers or they need some system development to record these numbers in order to report back to ERNs. So it's a continuous work together. We try to figure out some projects, some selling points, which they can say to the director that it is worth joining ERN Lung. For instance, some project on patient-reported outcomes. As I mentioned, clinical trial network, or as Francesco mentioned, some international collaborations which can be made under the umbrella of ERN Lung. Transparency is also another principle, I think, quite self-explanatory. So we are sharing responsibilities in specific cases, like we have with Francesco in this webinar, where I was talking about the general advantages of joining ERN Lung, and Francesco provided very detailed and very nicely presented details on sarcoidosis network, how they are really progressing despite they just recently launched it last year. And probably the mutual recognition, I think it's very important. And I also see during this chat that there was a comment from Hungary that that workshops probably not working in practice because nobody will join, or there's a chance that nobody will join. But what I see during this GOE project, and as I mentioned, we made lots of webinars. We are planning to make workshops, and I have many one-on-one meetings, is that once it comes to effectiveness, we already received many applications from sarcoidosis, from pulmonary hypertension and other disease areas. So I have some hard data that actually it's working in practice. But once it comes to mutual recognition, I realized that once there's a shared kind of, or double hatting, what I have, that I'm also a patient representative and also a member or representative of ERN Lung, it completely changed the gameplay. So once I approached physicians when I was rather a patient representative, we haven't managed to reach some kind of agreement. Once it come from officially from ERN Lung, with the support and very powerful support from the patient association, it completely changed the whole scenario, because they said that, okay, it's not solely a patient-led, but there's other physicians already in. So it's a kind of message to these healthcare professionals that they do not need to leave their comfort zone. This is what I'm really seeing, that once there's, discussion between patient association, solely patient association, and between physicians, and it's not always, or it's not about a specific patient's disease, some of the physicians are not tend to cooperate in a way that we from patient association would like to have. And once we have the ERNs, which is consisting of healthcare professionals, they said that, okay, this is a kind of territory I'm also familiar with. So I think that this is also a kind of um, facilitator in terms of the success of this Go East project. And last but not least, I think the clarity of roles and responsibility we already covered partially by Francesco or by myself, that that we have the understanding and the proficiency in some of the areas we try to sell. Our common goal is that ERN should be, or more specifically, ERN should be presented in many countries. But once we come to this, we know that, for instance, the patient organization are in raising awareness because they are, making this on a regular basis, making many projects on this. But on the other hand, we know that, for instance, Francesco can sell ERL lung from a completely different angle with projects which are important and interesting for the local healthcare professionals. So I think that this is the clarity of roles and responsibilities, that we say that, okay, it's important from patient perspective, but on the other hand, you as a healthcare professional can gain by joining ERNs and ERN lungs with this project, with these opportunities. Making a kind of process in understanding how we should make or how we should build up this Go East project, naturally a preparation was made. So we try to explore those countries which are outside ERNs. We try to explore our connections, what we have in these respective countries. And each and all processes, like we define the objectives and try to make the design we already covered nicely, the co-creation approach was always followed. So we have never made a single decision that, okay, we should make this and this. We always try to make common decision that, okay, let's start with webinar. Okay, let's start to make a workshop in those countries. Or probably I have a knowledge or I was referred to some of this physician. Let's try to make a one-on-one. However, I try to emphasize that in all cases, patients played a very important role. Myself, I started more than a decade ago as a patient advocate. Now I has, as I mentioned, a double heading. So from patient side, it was also a kind of support always from patient association. And we can go to the next slide, please. This is also an interesting approach from the patient partnership toolkit. I think we need to stress and emphasize that this project could not be possible without the appropriate culture and governance we have within ERN lung. So the patients are participating, and Francesco also mentioned this, in many initiatives and projects. Patients are in the medical steering committee, in working groups, in core networks, how we call, and in functional committees. Like the communication, like the patient reporting outcomes, the registries, and so on. This Go East project is nicely supported by the coordinator of ERN lung, by Professor Thomas Wagner. And as I mentioned already, I'm myself a patient rep, so it's a project management is also included. But once it comes to processes and organization arrangements, patient organizations and clinicians always cooperate, as we mentioned. And once it comes to organization arrangements, funding is also important. So we try to involve patient organizations funding. We try to involve pharmaceutical companies funding. It's a kind of conflict of interest we are really need to take care of within ERNs. We have a very nice conflict of interest policy, which was transposed from the European Respiratory Society, which is very strict. And I also refer to back to public funding. So we try to underpin our workshops with public funding from EU cause. I would not spend more time on competencies because we already covered within the principles. So next slide, please. A nice wrap up of this, and I also would like to have some lessons learned later on, but we already have covered the principles for a healthy partnership. It is a patient-led initiative supported by ERN Lung project management team and the coordinator of ERN Lung, and also the core network leads like Francesco. And this initiative is also enabled by the ERN Lung culture and governance. I might think, and probably we can go to the last slide, you might ask some of the difficulties we have or what we think might be the most appropriate approach if you would like to adopt, because I think that one of the objectives of this webinar might be how you can adopt this GoEast project in your respective ERNs. So once we started thinking about it, my first question was how we can sell ERN lung. So we try to make or try to identify our selling points. What are our advantages? How we can say to healthcare professionals who are not part of this, it is worth joining. A very nice tool for this, and we elaborated the SWOT analysis. This is the strength and weakness, opportunities and threats. So we make this and try to focus on this. Once it comes to discussions, it is not always about selling the good things, because you always receive the questions, but come on, we know that, and we already heard that you have some burdens on the shoulders of the members. So once it comes to organizing such kind of meeting, you always need to be very prepared in terms of the disadvantages. So this is the reason I put in the SWOT analysis in the very first point, because you will be asked what kind of burdens, what kind of reporting, how I can persuade my director or head of the department that it is worth joining because I have this, this, and this. I think some of the tools are easy to adopt. So I really advise you to kick off such kind of initiative as early as possible. But on the other hand, you also need to bear in mind that you need to be very prepared because you will receive many, many questions within one-on-one meetings, within webinars and so on. But once I think it's really important to emphasize that it's much more easier to try to focus on low-hanging fruits. Probably you can recall from the previous slides that we made distinction whether you are already in that country, whether you have some connections to existing healthcare professionals. So it might be probably an easiest way to extend the network to other disease areas who are not part of already within your ERNs, or try to get in contact with neighborhood countries who might have connections to Eastern European countries. For instance, how I made for the Baltic countries, that we have a very nice and established connections to Poland, because many physicians are going to some of the interventions, for instance, in pulmonary hypertension, to Baltic countries. So they have a good connections to the Baltic countries. So I asked some referrals to Baltic countries. And last but not least, I think that, but might be obvious, but I think it's important to underline that you need to build on already existing network connections. So even though that I'm asked to present any other kind of topic, I never miss to somehow link ERN lung, because it might be the case that someone in the audience is interested in and coming to me that, okay, how is it possible to connect? Can we have an offline discussion and so on? So once you are within your official role, never ever forget that you are also representing one of the ERNs. And I think that that was the last slide, and we are in time. It was a little bit a hurry in the end, Sorry for that if it was a little bit so fast, but we are happy to answer any questions together with Francesco.
Thank you very much, Gergely. We might not have too much time for questions, so I will also pop here your email in case people want to reach out to you and maybe ask you direct questions. That would be great. If it's okay for you for the sake of time. Or do we have any burning questions on the chat? Let me have a look. So we have one question from Matt. How we foresee Jardin to increase the connection of ERN with the local healthcare system? Do we need to have more members, or we need just to connect ERN with the local healthcare system in Eastern European countries?
Sorry, whose question was this?
From Matt Bold from Eurordis.
Okay. That's a very tricky question, actually, Matt. And many thanks for raising this, because you know, I think that sometimes it's really interesting to learn the specialties what we have in Eastern European countries. I was really surprised when it comes to time to diagnosis that some of the Eastern European countries are doing better than Western European countries. And the situation might be in some cases that they are more specialized and centralized than in Western European countries. So as Francesco mentioned, for instance, in Italy, they have many centers. If you check, for instance, Romania, they have 3 or 4 huge centers, and sometimes it's much more easier for them to make an appropriate diagnosis. Why I'm saying, because in such countries, it might be easier to integrate ERNs in their local healthcare system, but because they are having an additional kind of role or type next to the name of the hospital. But in other countries, in Western European countries, it might be some, I would not say it's a kind of fight about who is, you know, the expert center or who is not, but it might be more difficult than in Eastern European countries where they have, you know, huge centers. I do not know whether it was a kind of response to your question, Matt.
I think one part of the question was related to the connection of the ERN with the local situation or the national situation. This is a big issue we are also trying to address in Germany. We have created the German ERN Lung, for example, DE-ERN Lung, with the subgroups of diseases, and then we are trying to making pressure on the government, on the Ministry of Health, to receive some money for all the cases we are evaluating or treating within the ERN. So we are getting there, I have to say. It was a long way, 7 or 8 years long, but now we are trying to get a certain amount of money per patient within the evaluation, ERN evaluation, and then of course, it costs a little bit call of action, you know, and so on, but it's possible. So I want to say we are just the icebreakers, you know, in Germany or in the Western countries. And then if you start at the local level with your center to join the ERN Lung or other ERNs, of course, you will open a door to modify concretely the situation in your country. So it was unthinkable also in Germany, where the structure was very rigid, you know, but now we are really getting a voice, and this voice is guiding some, for example, re-evaluation of money. The term is Pauschale in Germany, so the money which is assigned to a certain disease for diagnostic, for example, procedures. It was very low for a disease. It's a very low amount of money. And then we are, through this pressure, we are getting there. We have more, let's say, recognition for this disease in terms of costs refund. Just an example, what is the possible development also in your country, in a, not in the near future, but in a, let's say, 5 to 10 years perspective? This is another
Yeah, I
question,
think,
Matthew.
yeah. Sorry, Matt, just one reflection on your question. I think that the first option should be followed because ERNs have no resources building up to each and all member states such kind of connections. I would rather put on the local healthcare providers' shoulders
Yeah.
this kind of connections because this is the way how they can ERNs better integrate. Within ERN, we have had a kind of project on this, which is about a patient pathway. It is about how the patients are from GP level, general practitioners, to ERNs or ERN lungs are going. So I think that this nicely resonates with this question and nicely being should be more explored under the umbrella of Chardon, because I think it's not a viable solution where we, as ERN, like, have connections to Romania, Bulgaria, and all these countries who are not already represented.
Matthew?
Matt, you have the
So I completely agree with you, Gergely, about the value of having centres from the Eastern European taking part. And it's not about West teaching East, it's us learning from the East as much as them learning from us. It's a two-way learning thing. So I absolutely support that, and what you're doing is it should be applauded. I think with the joint action, it is a political spotlight, an opportunity which we should leverage over the next 2 to 3 years to get more centres from Eastern European countries connected into the ERNs, either formally or working with them. So I think it's what I can't remember, maybe Ines is more close to this, is I'm not sure with the way that Jardin is structured, how we can use the opportunities in those different work packages to engage and to entice those clinicians from those different countries to get involved in ERN lung. I'm not quite sure how we can make Jardin work for us or from the network's perspective. But I just wanted to highlight, I think it's an opportunity to strengthen the work you're doing, and we should explore that further.
Completely agree, Matt. So we are in a planning phase. So we thought that it might be practical to connect the Sofia University in terms of this. I also saw a question from, if I may, from Hansi. It's a kind of disease-specific one. So and it's linked to a patient organization because the link which was put in this, I do not know how to pronounce it.
Hansi, what would be the relation or usage of sildafanet.org?
Yeah, it's about patient. It's an umbrella association which is covering patient organizations which are based in Eastern European countries, and the disease is ILD. So this is interstitial lung disease. We have a very nice connections to them. So as I saw, we have Natalia, who is representing pulmonary hypertension in Bulgaria, and this organization, which was referred by Hansi, it is represented by another patient who is also part of the working group on the workshop, which is going to happen in Bulgaria. So this is the connections towards side pen. I do not know how to pronounce them anyways. So this is the connections. We already have an established one.
So on Jardin, this is Ines. Jardin's side, there is a work package looking into national networks of centers of expertise or similar mechanisms to link the ERNs with the local healthcare providers, let's say. So that's one work package. And then there is another one that is looking more specifically about granting more support to the centers that are part of the networks so that they can really have a more, I'd say, more important networking and a more important role at national level, not just as part of an ERN, but themselves in the healthcare system to be kind of those antennas, etc. Hopefully, fingers crossed, those kind of things will come out of Jordan and they'll help to build what is needed, or at least put the foundations, because it's just a 3-year project. So.
Thank you, Ines. Thank you so much. And thanks again also to Gergely and Francesco specifically for being here today with us. I think it was a very inspirational presentation. So thank you very much for that. I dropped on the slide the code and the link to the satisfaction survey that would help us a lot to improve in the upcoming webinars. So yeah, I hope you like this one, and see you maybe in the next one. Thank you so much. I will now close the webinar. Thank you.
Thank you so much for the invitation.
Thank you. Bye.
Thank you. Bye-bye.
Thank you. Bye.
Bye.